You wanted to know what you can expect during a C-section at an Intermountain hospital. You have a pretty good idea of what to expect during the recovery, so you want to know what happens from the time you show up till the time the baby's born. And having worked at an Intermountain hospital for 12 years, I can give you the basics of what to expect. If it's a scheduled C-section, then you'll be called the day before and notified of the time that you should arrive. And they'll tell you not to eat or drink anything past a certain point, because if you have anything in your stomach, even water, that can increase your chances of complications. So don't eat or drink anything after the point that they told you to stop at. When you arrive on the day of your C-section, a secretary will check you in, go over policies and procedures, and then take you to a room. The nurse will come in and go through your history, start an IV, administer some medications that the doctor has ordered in preparation for the surgery, and then an anesthesiologist will come in and consult with you about anesthesia care during the procedure. Usually an epidural is given for the procedure, and there's many benefits to this because the risks are much lower than general anesthesia, which is the alternative, and it also allows you to be awake and alert for the delivery of your baby so you can hear them cry for the first time. One important thing for women to understand is that with an epidural, you feel tugging, pulling, pressure sensations during the surgery, so that's not a bad thing, but you won't feel pain. It does mask pain, but not all sensation. So if you go into it with that understanding, then you should be more at ease during the surgery. Now, another alternative to an epidural is a spinal, and this is usually done in the operating room because the difference is it onsets very quickly, like within a few seconds, instead of setting up over like 15 or 20 minutes or so. So either way, then you'll be in the operating room and prepped for the surgery. And you can have a support person, which is usually dad, by your head with you the entire time. The anesthesiologist will also be with you, and they'll be supporting you and making sure that you're as comfortable as possible. A blue drape goes in front of your face so that you can't see what's going on unless you'd like to, and then there are things that we can do or accommodations we can make in order for that to happen. The total amount of time that a woman spends in the operating room is usually about 45 minutes to an hour, but the majority of the time is spent stitching each layer back up the way the doctor found it before they delivered the baby. It usually just takes a few minutes to actually deliver the baby, and then they go into a separate room where they're cared for by the nursing staff to make sure they're transitioning well from water to air. And then what happens with the baby after that while the doctor's stitching you back up depends on how stable the baby is. Sometimes there's an opportunity for the dad to hold the baby in the operating room until the surgery is done, and then you can even do skin to skin once we get you on a new bed and we get you all cleaned up. You're then wheeled to your labor and delivery room, and you can continue to do skin to skin and try to breastfeed the baby. Sometimes we can even try to do skin to skin with the baby in the operating room, but traditionally the baby is up and down, chest to chest on you, but because of logistics and the fact that you're sterile from about the ribs down, the baby can't lay like that, but they can lay horizontally on your chest or perpendicular to your body. So their head is resting on your shoulder and their body is across the top of your chest. Some women love this closeness during surgeries, but others feel a little bit smothered or claustrophobic and want to wait to do skin to skin until after they're done with the procedure. So if this is a desire that you have, talk with your nurse and they'll be able to determine if the baby's stable enough and if the resources are available to make that happen. Now, sometimes a baby has to go to the well baby nursery or to the newborn ICU. There are times when they need to be watched or monitored more closely or have procedures done to make sure that they're healthy and well. In these cases, the dad is encouraged to go with the baby wherever they go, and then the dad can come back and give the mother updates. As soon as the mother's done with the surgery, she's taken back to her labor and delivery room and watched closely for signs of bleeding after the surgery and after the delivery. Vaginal bleeding is the same after a C-section as it would have been for a vaginal delivery because it's the uterus healing, not the vagina. So you can expect bleeding for about 3 to 6 weeks, but the biggest risk for hemorrhage exists within the first couple of hours after delivery. So even after a C-section, the nurse will watch you very closely for signs of bleeding by monitoring your blood pressure and your uterus to make sure that things are looking stable. Once they've determined you're stable, they'll clean you up and move you to a new room, and that's where you'll stay for a few days until the doctor determines that you're well enough to go home. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/ Intermountain moms and recommend us to your friends and family too.